it was one of those things that I really couldn't believe it, because it was like a funny thing on a mammogram, and I could tell by the way people were looking at me there was something different about it. And I was getting angry even thinking about it, because somebody like myself does not get breast cancer. It's impossible. I, went through probably the journey that a lot of women go to, and they find out that they have this horrible death sentence, because that's the way I looked at it, as breast cancer. I think it hits everybody differently. And I think I probably would, depending upon the person, I'd probably advise them to talk to as many people as possible, and definitely be able to talk, to get a variety of opinions, and really tune in to people that really paid attention to her and listened to her and really understood what her fears were, and at the same time be able to work with her on what her expectations were. And I would highly recommend that along her journey in checking out these various places, reading and become as knowledgeable, she gets to ABCs. Because I think there, even if she doesn't choose to have brachytherapy, even if because of the type of cancer she has, she may not be eligible for it just overall, but she goes there to be able to get an idea and the respect back to her as a woman who's going through this, so she can carry that with her and hold that expectation out to any professional that she would come in contact with after that. But I would definitely say, put this in. It's the best education she would get, and if she's lucky enough to have that be the kind of treatment that's perfect for her, then it's a win-win all the way around for her. And I would say, if you are lucky enough to have brachytherapy, and if you are even luckier to have the Savvy device, because it is probably one of the really high-tech, really profound ways to be able to deal with this breast cancer thing. I would say that when you begin moving forward with your life, that is also the continuation of your treatment. It is how you become more physically active. It is how you choose to eat, how you choose the people that you choose to be around you that are also uplifting and life-giving and support you. That you tune in to the atmospheres and the environments that you place yourself in, because those are things that are also going to add to your ultimate recovery, not only physically, but mentally and spiritually. Because when someone says to you that you have breast cancer, that's a huge spiritual type of hit that your whole being takes. And so I think that is a lot of all of those things are things that are addressed at ABCs, really addressed there. So from there on, it is really kind of the beginning of the beginning.